Hello, welcome to Dr. Cordero's office. How can I help you? You have an appointment. Okay, perfect. Let me just look you up in our system. What was your first name? Okay. What time is your appointment? Okay. So just to confirm your identity, I'm going to need your, apologize. I'm going to need your full name and date of birth. And date of birth? Perfect. Okay. So now that we have that all taken care of, I'm going to see if your records need updating, okay? Perfect. So is your address still the same? No? Okay. So what is your new address? Peak as in P-E-A-K? Perfect. Okay. And city? Okay. And postal code? Perfect. Okay. Sorry, this chair is a little high. Okay. Is your telephone number still ending in 096? No? Okay. What is your new telephone number? Perfect. And has your insurance provider changed at all since we last saw you? Okay. And your insurance policy number? Nine, 6, 1, 2, 5, 3. Okay. Has there been any change in your medical history since your GP last saw you? No. Okay, perfect. No change in medical history. Okay. So I'm just writing down that you were updated in our records and your insurance provider has changed. Just so that they know. Okay? So, hello, I'm Dr. Cordero. Yes, it's dress down day in the office and I thought it'd be ironic and put on a t-shirt with a really nice jacket on top. So, okay, so we're gonna get this cranial nerve exam going. So, from what your GP has told me, you have had nothing wrong with your sense of smell or taste. Is that correct? Okay, and nothing has changed since then? Perfect, okay. So can you see my face? Is it blurry? Are you experiencing any double vision? No, perfect, okay. So we are going to now look at this chart right here. And I want you to read the smallest line. Okay, so it's this one. Perfect. Oops. Okay, so read it from left to right. Perfect. Okay, so now that was with both eyes, we're going to look at one eye at a time. Okay? So cover whichever eye you like. Okay. Now read from here to here. Perfect. And now from here to here. Lovely. Okay. Now with your other eye, do the same thing. I want you to read from here to here. Lovely. And from here to here. Brilliant. Okay. So that is done. Now I'm still going to be checking your eyes, if that's all right. Okay. Let's see. I want you to look at my nose. I'm going to be wiggling each finger, and I want you to tell me which fingers are wiggling by pointing to them, okay? Okay. Perfect. Brilliant. Brilliant. Perfect. Lovely. Brilliant. Good. Okay. Okay, so now we're going to be checking your visual fields. I want you to cover one eye at a time, whichever eye you prefer. Good. And I'm going to be covering my same eye, and I'm going to be wiggling my finger into your visual fields, and I would like you to tell me when you can see it by saying the word yes. Perfect. Okay. Okay. Good. Good. Brilliant. Brilliant. Okay, now your other eye. Okay. Lovely. Lovely. Brilliant. Brilliant. Okay. Now we're going to be looking at your blind spot. Can you see this? Perfect. Okay. So I want you to cover whichever eye. And I'm going to be moving this in and out of your field of vision. There is a specific blind spot in between when you look from one eye to the other. There is a blind spot in there, if you didn't know. And I'm going to be looking for that, okay? Okay, so cover up one eye. And cover up that same eye. Tell me when you cannot see it. Okay, reappear. Good. Disappear. Reappear. Good. Now, disappear. Reappear. Disappear. Reappear. Okay. Now the next eye. What color is this pen? Good. Now I want you to tell me when it disappears and reappears. Perfect. Okay. Reappears. Good. Disappears. Reappears. Perfect. Disappears. Reappears. Disappears. Reappears. Perfect. Okay. So now I'm going to be looking into your pupils. Perfect. Okay. I'm going to be looking into your pupils, okay? Just looking for dilation. Okay. Perfect. Okay. So now I'm going to be going from far away, and I'm going to be looking in your eye, and I'm going to be telling you to look in specific directions. But right now, I just want you to look past me, okay? Perfect. Okay. Look at the light, please. Perfect. Now look up. Okay, keep looking up for me, please. And look down. Perfect, you're doing wonderful. Thank you so much. Now keep looking down. I'm looking. I'm still looking into your eye. Now I want you to look to the left. Perfect, you're doing wonderful. Thank you. Okay, now look to your right. Lovely, okay. You're doing the same thing to your other eye, okay? Perfect, okay. Keep looking past me. Okay, perfect. So now I'm going to be doing that again, but I'm going to be asking you to look in way more directions, okay? So right now I'm going to be asking you to look past me again, straight ahead. Perfect, okay. Oops, the light turned off. Turn it off. Let's try to fix it. So we fixed it, okay. So keep looking straight ahead. I'm going to be looking into this eye really quick. Okay. Keep looking straight ahead. Thank you so much. Okay, now look up. And look to the right, please. Look up and to the right, please. Okay, now look down and to the right. Perfect, now look down. Yes, perfect. Keep looking down for me, please. I know that's kind of it's a hard position for your eyes to hold, but this is the most important part. Perfect. Now down to the left. You're doing brilliant. Thank you so much. Okay. Now to the left. Brilliant. Lovely. Thank you so much. And then to up and to the left. Perfect. Okay. I'm going to do that to the other eye, okay? Okay. Look up, please. Perfect. Now up and to the right. And now to the right. And now down and to the right, please. Perfect, you're doing brilliant. Thank you so much. And now down, please. Lovely. And down and to the left. Perfect. And now left and up. Perfect. You're doing brilliant. Thank you so much. Okay. So now I want you to follow my finger, okay? I don't want you to follow it with your head, but just your eyes. Okay, perfect. You're doing brilliant. Thank you so much. Brilliant. Okay. Now I want you to do some faces for me. If you could just lift your eyebrows. Perfect. Now squeeze your eyes shut. And I'm going to try to open them. Don't let me, okay? Perfect. I want you to puff out your cheeks. Brilliant. And now I want you to show your teeth. Perfect. I want you to clench your jaw, and I'm going to feel your muscles, okay? Brilliant. Okay. Now I want you to open your mouth and stop me from closing it. Brilliant. Now I want you to say, ah. Just looking in there really quick. Can you move your tongue from side to side like this? Brilliant. And up and down. Okay, now push it against your cheek. And stop me from pushing it in. Okay. And do it to the other side. The other side, please. Perfect. Okay. I want you to look to the left and stop me from pushing it to the right. And look to the right and stop me from pushing it to the left. Now shrug your shoulders. Shrug your shoulders, please. Okay, perfect. That was brilliant. Thank you so much. Yeah, I didn't see anything to complain about. The only thing is that I felt your jaw muscles and they feel a bit tight. Yes. So I would suggest going to your dentist to get that checked out, okay? Thank you so much. It was nice meeting you. Bye.